It is that time of year again. It's not just the holiday season, it's also the cold and flu season.
And a new COVID-19 variant has emerged. ABC 10's Devin Truby joins us now. Devin, you've been looking into this. How serious is this?
It's definitely a concern, Laura. The new variant has the attention of the CDC. It's called JN.1. It's responsible for almost 30% of all the new COVID cases in the U.S. right now. Doctors say that means it's either more transmissible or it's better at evading our immune system.
As we continue to celebrate the holidays, a new COVID-19 variant is making the rounds. The CDC calling it JN.1, the fastest growing variant and somewhat more contagious.
Concerning variant, it seems to multiply about twice as fast as more recent variants. And it's more than doubled in terms of the proportion of isolates that have been detected in the U.S. over the past 2 weeks.
The CDC says the symptoms of the latest variant vary depending upon a person's immunity and health. JN.1 was detected in the U.S. in September, classified as a descendant of the Omicron variant, which overwhelmed hospitals last year.
Seeing hospital admissions for COVID, there's certainly an uptick, and we've seen that with California and nationwide numbers.
This year, according to the CDC data, hospitals aren't seeing as many patients. The weekly average of new hospital admissions is 2,488 compared to last year's 4,790.
So one of the things that we're seeing this year is there's more people who certainly have immunity to COVID, either from vaccination or from infection or the combination of the two. And the good news with COVID, with this new variant JN.1, is that our current vaccine appears to provide excellent protection against that.
The positivity rate for flu right now in California is the same as COVID, 8.8%.
Influenza is also on the rise. This increase in COVID cases, we do expect there to be a bump in cases, a surge. This should peak within the next month or two.
If you take a look at this graph, you can see ICU bed activity is flat. And the two blue lines on the graph show this year and last year are similar, around 1,500 beds open.
There's still plenty of time to get a COVID and flu vaccine, especially for them to be effective for your holiday gatherings.
I have some older relatives in Boston who say they don't have COVID, but they've been sick for weeks now. So keep in mind there's also an RSV vaccine for adults 60 and older.
Brand new this year.
Devin, thank you.